Okay, this skill is going to be penetrating chest trauma. We're responding to an injured person at residence. As we arrive on scene, we have our BSI on and the scene is safe. Law enforcement is outside of the residence. He advises that the patient is inside the residence, laying on the living room floor, and that he has the assailant in custody. As we approach the patient inside the residence, we see the patient lying supine on the ground, and we see an oozing, bubbling wound coming from the right side of the patient's chest. As we approach the patient, say, "Hey sir, what's going on today?" He states that his chest hurts and that he was stabbed in the chest. "What were you stabbed with, sir?" "A long screwdriver." Okay, we've confirmed the mechanism of injury can cause penetrating chest trauma. We expose the wound area and we find a bubbling, oozing wound to the right side of the patient's chest. So we'll go ahead and immediately place a gloved hand on the patient's chest to prevent any sort of loss of air or increase of pressure inside the chest. Okay, sir, at this point we're going to go ahead and place some oxygen on you. It's going to help you breathe just a little bit. And we're going to go ahead and continue treating you, okay? Patient says that it is okay. So at this point we'll go ahead and roll the patient over to expose the back to make sure that there are no exit wounds that need treatment. There are no exit wounds present. And now we will go ahead and take our stethoscope and we will auscultate the patient's lungs to determine if there is truly any penetration to the lungs. So we want to go ahead and auscultate the upper and lower lobes and along the mid-axillary line of both sides of the chest. And at this point we have determined that there is a diminishment of lung sounds to the right side of the chest. So we've determined that an occlusive dressing will be required for this. So we'll go ahead and get some gauze, and we'll remove our hand and wipe away any excess blood off the wound site, and immediately place our occlusive dressing over the wound site, taped on 3 sides, ensuring that we do have an opening to the lower side of the wound to allow for any drainage of fluid. We'll make sure that we press the occlusive dressing tightly over the wound itself and press down on it to complete a seal. Once the occlusive dressing is in place, we will ask the patient if there is any ease of breathing, and if the patient states that there is not, we'll go ahead and check the dressing again. We want to go ahead and re-auscultate lung sounds to make sure that there is any improvement to the right side of the chest. Once that is completely set, we'll go ahead and prepare the patient for transport, oxygenate as necessary, or reassessing the patient every 5 minutes during transport.